I truly believe it's so very important to love what you are doing, because otherwise there's no way you can give your best, or be at your best or live your best. So what you love is becomes really important, but then what you love goes into two direction. It can be a passion or it can become a mission in your life. Um, then with the passion comes, what are you good at? So your passion turns into profession. And then the mission goes towards what you need and what the world needs, right? So it becomes profession versus vocation. That profession is something you're doing for yourself, and vocation is when you volunteer and do things for others. And but then the importance piece is what you can get paid for, right? Because the honest truth is, even if you are passionate about a purpose or passion, you're always needing that financial freedom to be able to pursue what you are hoping to achieve in life, or pursue your passion or pursue your dream. So keep that in mind, and let's talk about why then psychiatry becomes a very important profession, vocation to pursue, and kind of fulfills a lot of these aspects of your life. So next slide I want to keep in mind is, why psychiatry right now? Honestly, even before COVID-19, we were on verge of a mental health crisis in the world. But the COVID is literally, I feel it's this big wave coming over, how we were barely balancing the need versus resources when it comes to mental health in globally and also in our country, and of course in Michigan. So Michigan right now have at least 33 counties which do not have a psychiatrist. Let that sink in. On the other hand, in the country, every year there is almost a deficit of 3,000 mental health providers, psychiatrists. Literally, if we go with patient to provider ratio, we have a shortage of 3,000, roughly 3,000 psychiatrists. And I'm talking about pre-COVID numbers. We don't know how. So on one hand, you have this huge deficit and need happening. So there is like huge epidemic, pandemic of mental health crisis that's happening. And then you have the shrinking resources that we do not have enough mental health providers. So even if we look at the growth wise, there is almost 16% growth in the career trajectory for a psychiatrist. Like it has become so dynamic profession right now, such an area of shortage, such a that even if you um, like our graduates right now, if when they are graduating from residencies, they are being offered 200,000 plus um, job incentives. You are getting loan forgiveness programs. So if you look up any state for licensing right now, you would see that they have this area saying that, oh, we have a shortage for psychiatrists, and you can get an expedited license if you are a trained and board certified psychiatrist. So career-wise, right now, not only if we look at it from financially, but the fact that this need is growing. So we saw a very important increase right now when we saw applicants to psychiatry residencies. Also, the numbers jumped. But unfortunately, we have not caught up with like by increasing more residencies or by increasing more number of slots for psychiatry residents. So that's one area that of deficit. What that does, if you are opting for psychiatry, of course, is the fact that you will be in demand and need. But what, as a medical student, what is happening right now, especially we are just interviewing, and I've seen amazing medical students now opting for psychiatry, like just mind blowing, amazing, who have like good credentials, good working experience, passion, innovative thought processes. Like it's just such an exciting time to be a psychiatrist. But that does mean that the competition has increased. So we have more applicants coming in versus how many seats are available right now. So if you are gonna opt for psychiatry, that's a big change that has happened. But talking about mental illnesses and concerns that I have, I really worry about this wave engulfing us. That's how I feel. This is the point where mental health field is at this point. And unfortunately, still, we do not have policies reflective of it. Now, why is that? That brings me to the stigma that we still have. So let's sit with that. What is stigma? Stigma literally is when you feel ashamed of something. When you feel ashamed, the shame keeps us silent, and this silence breeds the stigma. Do you realize that if now, when we are at a point where there was a time we would say 1 in 5 or 1 in 4 people are having mental health concerns, right now we are at a point where 1 in 3 are suffering from mental health concerns, mental illnesses, or mental health concerns. I think at this point, I also want to make sure that we differentiate. When we say mental, it doesn't mean automatically you're talking illnesses. We need to understand that, like any other profession, psychiatry has become so dynamic, so preventive, that we are in the realm of how we can have good mental health versus mental illnesses. So health, resilience, wellness, that has become such an integral part of your psychiatry practice, that you are not only dealing with disease and illnesses, you're also focusing on how to augment someone's resilience, sense of well-being. So um, now when we talk about the stigma, unfortunately, this tide is growing, but what is the biggest barrier in access of care is the stigma. And how does this stigma plays out? And you would see in cultures like I'm coming from, or in minority settings, or in faith-based community, but I also see it very prevalent in the society, that we have this dichotomy that if it is a physical symptom where you can see it, you can see someone's hand broken, or cardiac EKG showing us some problems with the heart, until unless we can see it tangibly and hold on to something, we think it doesn't exist. And the biggest problem with the mental illnesses are these are these are the pain, psychic pain. These are injuries and trauma that cannot sometimes be quantified. And that's where our shame comes in, that, oh, if nobody can see it, then maybe it doesn't exist. Or maybe it's in my mind. It's something I need to control and fix. So this is how stigma plays. One thing is it stops you from accessing your own care. But other way the stigma is working in the society is we don't have policies which make mental health central. We have parity in the country, which literally means that the insurance should have the same coverage for mental and physical health concerns. But is it being applied in all the states? Not necessarily. So you, on one hand, you have this shame that you don't want to access care. On the other hand, you do not have good care available. Even if you get over the stigma in the society is impacting us by policies. So you do not have enough coverage. You do not have enough providers. You do not have good state-of-the-art treatment plans. Our industry, pharmacology-wise, we are very restricted. So it's a billion-dollar industry bringing in new medications every day, but not many new innovative medications are coming. We are still dealing with a handful of medications to treat these concerns. So another way stigma was playing in a lot of, I travel globally a lot, and I see this infrastructure issues with mental health in so many countries, like a country like Jordan, which is now carrying one of the highest refugee population in the world, has 300 psychiatrists. Imagine that, 300 psychiatrists, no geriatric psychiatrists, and 1 or 2 child psychiatrists. So I see that happening in this country as well. So I talked about, like, there is 30 at least counties which do not have a psychiatrist. If you go in further specialized fields like geriatric psychiatry or child psychiatry, then of course there's absolute dearth there. So that's how stigma also plays, that the best of the best in the field were not coming and becoming psychiatrists because of their own fears and then not having the support. So in my family, when I come from a family of, I say there's a pandemic that you have to be a physician, that kind of family. So I have a lot of physicians in the family, internist, oncologist, nephrologist, cardiologist. So now we have a few psychiatrists. So when I came and said that I want to be a psychiatrist, what's the standard reaction you would get? Like, I'm talking a good 15 years back, is like, don't you want to be a doctor? So the concern and the disdain, they are worried that you are throwing away your career by becoming a psychiatrist, or the concern, disdain, like, why psychiatry? Or being told that, like in the community setting, being told that, oh, we don't think psychiatrist is a real doctor, right? So when you hear these kind of messages, it was impacting the best of the best to come towards psychiatry. So for me, the last couple of years have been very encouraging and heartwarming to see some of the best medical students now opting to become a psychiatrist. Otherwise, what used to happen, psychiatry would be kind of a last option, like, oh, if nothing is going on, let's apply to psychiatry. Another change that I see, people assume that being a psychiatrist is such an easy job that people were opting for it for an easy lifestyle. That said and done, definitely psychiatry still is one of the fields where you can maintain very good life and work balance, and especially as a woman, because when you are going through medical schools, you are at a point of marriage, wedding, having children. That does play an important role as a woman to find that balance. And I still feel psychiatry definitely is one of the fields that still offers you that kind of life and work balance. But people were coming to psychiatry for all the wrong reasons, and that is changed. That is the biggest thing that has changed in the field, is people are waking up to the importance of why it is important to have mental health. Now, to me, really, I put psychiatry next to religion, art, and psychiatry. And why I do that? Because think of it this way. These three places are where we really learn to identify ourselves or express ourselves. So leave psychiatry, think of religion. When you are, and religion doesn't mean just um, rituals and belief system. Religion could be faith, could be spirituality, or some kind of, like, looking up to some higher power, some kind of ethereal experience. When we are practicing religion or faith or spirituality, what happens is you get this feeling of reward, being rewarded. You feel moral, you feel ethical, you feel cleansed, you feel taken care of, pampered, and you feel that you're doing good, you're doing right. And that's the feelings you get when you are a psychiatrist and you are sincerely and passionately and truly serving your patient population. That's the feeling you get, the moral, the ethical, the spiritual boost. So I feel that this is a profession that really, all the professions, medicine, medical professions, you are saving lives. But this is where I feel psychiatry is becomes more essential or integral and closer to bringing this quality of life to someone. Art, another way where we are fully truly ourselves, is when we are expressing ourselves through art, um, be it painting, singing, music, drawing, writing, whatever way you are expressing and being your authentic self. That's where you can, in psychiatry, I feel you can really be your authentic self. So it's not only that you are helping others get to their best optimum life, you at the same time are growing and trying to get to that best optimum quality of life for yourself. But where does the key lies is being honest, being passionate, being sincere. That's where you truly get the benefits of being a psychiatrist. So I think I am kind of giving you both pictures. Where does the challenges lies is remembering that as a physician overall, and especially I've seen this a lot in, if you are surgeons, we tend to forget that we are playing God. As physicians, we are playing God. We get that close. Some of the professions, more so than the others, are absolutely saving lives, right? So we are playing God, but we are not God. And it's so very important as a psychiatrist to remember that, because what happens is we get into that mindset that we are here to fix everyone. And if you get to that mindset, that's where the negative aspect of being a psychiatrist is. Very, very important as a physician right now to walk away from that paternalistic thinking, but more so when it comes to psychiatry. Why? Because you are seeing people at their most vulnerable. And if we go with this mindset that I know what is best for you, or I know how to fix you, you are not in the business of fixing people. That's the biggest wrong notion people have about psychiatry, that you are in business of fixing people. You are not. You are in this journey to hold someone's hand and walk them to their best life. You are just that support, that companion that is holding someone's hand through this journey. You become the bearer of pain. You are you are sharing their pain. You are walking with them in their pain. But what happens is, how do you keep that balance? How do you not let that pain engulf you to a point that you lose the boundaries of professionalism and get too involved or get too personal, or you get too autonomous and paternalistic and arrogant and say, hey, this is what you should be doing. This is Medicaid. Of course, we need to have our professional, we can never compromise on our professional um, needs and requirements, which is like, ultimately, we need to keep these people safe and kind of bring them to a point that they can value their life to and not hurt themselves or harm themselves or harm someone else. So remembering that you might be getting close to playing God, but you are not God. And also the saddest piece for any physician is when they lose their patients. But somehow when you are doing surgery or you are a cardiologist and you lose patients, or you are a neurologist and you lose patients, in your mind, somehow you come to the conclusion, oh, I did everything. I put them on these meds. We tried this surgery and this is the best we could do. That's the area which gets very tricky for a psychiatrist. When we, God forbid, unfortunately lose a patient and they go on to complete suicide or hurt themselves or hurt someone else or end up in some really traumatic situation or legal situation, you automatically go in that mindset as like, did I do everything? Could I have avoided this? Could I do something more? And that's the trap. That's where you need to understand your limitations, that you try your best, but you always are prepared to for the worst. So I want you guys to look at this again, and I want you guys to now sit with this, and then I want you to I want to open this up for more questions, like how do you feel you fit into this world of psychiatry, or why do you think you want to be a psychiatrist, and what's your fears or anxiety or apprehensions that it would be harder to be a psychiatrist? Should we, let's do one thing, let's everyone unmute. And actually, I don't know if you guys want to open the cameras too, or
Yeah, if everyone can, if you feel comfortable, turn your cameras on. It's fine. I'm still drinking my morning coffee too.
see, this is one place you can be completely yourself. So just quickly talk about authentic self. What does it mean to be authentic self? It does not mean you are the best in the world, but it's also knowing you are not the worst. So all of us have strengths and all of us have weaknesses. So the idea of finding your authentic self is that you know what your limitations are, what's your strength, what's your area that you need to still work on. So being very aware and cognizant of who you are and accepting it. And I think the biggest thing I teach is self-love, loving yourself, accepting yourself, loving yourself. Because I think for the longest, we go through life thinking things happen outside and we react to it. The honest thing is, things don't flow from outside inside, things flow from inside outside. So what we are thinking about ourselves, the fears, the anxiety, the good, what we think we are good at, I think that's where what we are seeking then constantly is that validation from outside. But unless you can validate yourself, no compliment will feel true and every criticism will feel true. So that's what I always talk about, is how do you find your authentic self is the first step to this journey of life. Okay, any questions before we talk more about?
Yes, I had a question, Dr. Abbasi. Thank you so much for this talk. I like screenshotted this picture. I really like this Venn diagram. So I've been wanting to do psychiatry since I was 15, so like 10 years now. But what I'm finding is that, and I wonder if this was your experience, as I'm going through more and more in medical school, I'm really liking anatomy lab. I'm liking learning the different systems. So my concern, or I guess something I'm just thinking about, is if I do choose psychiatry, I'm kind of leaving behind these clinical skills that are enjoyable. So I'm wondering if you ever dealt with having to kind of choose one or the other.
Thank you. Thank you so much for asking that question, because that's the biggest, I think, misinformation about psychiatry. So I was internist, right? And that was my biggest fear. Am I giving up medicine, and would I ever get a chance? Honestly, psychiatry right now is where you are gonna need all this information. What happens by the time we see a patient, they are already have health issues, or they have been on medications, or they are already in treatment with other physicians. And honestly, sometimes it comes upon us to kind of bring all these informations together. I'll tell you, I was big on neuroanatomy. Neurology was my passion. Medicine, but I was in internal medicine. Every bit of that information comes handy today, because if I'm prescribing a medication, I need to know and know how to interpret my labs. I need to know how all these diseases are impacting the mood. So take 4 top diseases in the country right now: cancer, COPD, um, cardiac CVA, strokes, and cardiology, cardiac arrest. What is the most important underlying piece with all these diseases is we are realizing the impact of stress and depression on these diseases. Then there is a set of diseases, like, let's say, neurological diseases, Parkinson, Huntington, even diabetes, that actually the first symptom they might show is depression before rest of the disease develops. So until unless you know that what is causing what, it would be hard for you to make a good clinical judgment. So none of these knowledge or information ever goes missing. Okay. So you enjoy anatomy. In my case, neuroanatomy automatically helped me with psychiatry, because it's not, our emotions are not happening in vacuum. What we are realizing, take an example of something small like dopamine. Dopamine is what keep us focused and motivated. But dopamine also controls your body movements. Uh, Dopamine works in your reward system. Dopamine works on your, so it's like it's impacting the whole body, right? Until unless I know, think of the relationship in Parkinson. When the dopamine is zero or decreased, then everything in your physically, everything slows down, but it also slows down mentally. And now when we treat Parkinson people, we give them dopamine or dopamine agonists. What happens? Their dopamine surges causes them to become psychotic. So I think, unfortunately, this dichotomy was created between physical and mental health. It's one body. Where does your mind lies, right? So where is your seat of emotions? So it's like, it's one body. So you don't walk away from any aspect of medicine. In fact, I realized the more and more I'm practicing and trying to become a good, not become a good psychiatrist, but being a good clinician. If I think of in terms of clinician, I can't be a good clinician if I don't know what's happening. Another example, OBGYN. We have females in productive ages. Right now, somebody I'm treating is going through a pregnancy, and she's going through possibly a psychotic breakdown. unless I know how different phases of pregnancy impact you hormonally and clinically, how can I make good clinical judgment of managing your depression, your psychosis? I hope that answers. So you actually, I think you can really right now bring all your passions to psychiatry, be it medicine, be it surgery, anatomy, but be it music, be it art. It's such a dynamic time to be a psychiatrist. Like the set of students that I interviewed, our singers are doing narrative therapy, art therapy, music therapy. Some are thinking of, oh, another field I'm working on right now is artificial intelligence and mental health. Robots working with you, with patients of dementia, robots working with autistic kids. So it's just, this myth that if you are a psychiatrist, you just are in some kind of other realm. No, we are very much integral to the care right now.
That makes a lot of sense. Thank you so much.
Thank you. That was such a good question. Any other questions?
Feel free to just unmute yourselves and ask, or if you're nervous to do that, you can type in the chat box. So,
Dr. Abbasi, thanks so much for your talk. I was just glad that you talked a little bit about self-stigma, as well as kind of like the paternalistic aspects of psychiatry. Seeing that you mentioned that you work a lot in cultural psychiatry, I was just kind of curious your thoughts on sort of addressing those issues within Muslims. I myself am Indian, so I'm well aware of the stigma that exists within our community, especially with maybe even Black folk in this country. You're kind of talking about psychiatry being next to religion and art and all these things. So what's kind of your approach to sort of addressing someone who's maybe at the point of like acknowledging like yes, mental health is a thing, but I don't want to go see a psychiatrist because they kind of view this as a Western influence or something
Right, right. They think we are pill distributors, or like we love to give medications, which is absolutely, you would find it the more you interact with the psychiatry rotations, that we actually are very miserly when it comes to prescribing meds. But like I always give the example of diabetes, that when you are pre-diabetic, the physician would tell you, make lifestyle changes, decrease your stress, do diet control. It's only when you really absolutely need, they would start you on oral hypoglycemics. And then some people get to a point where they become insulin dependent. So that's the way with mental illnesses. But coming to the stigma in minority settings and faith-based communities, I think the biggest challenge I face is that in faith communities, especially, it's considered like a failure of faith, right? A spiritual weakness, that why don't you trust God? But what I'm seeing right now is, I think what happened in this country when you separated religion from state, somehow we kind of walked away from religion, spirituality, and all these practices in medicine. Somehow it became like, oh, it's not scientific to talk about these things. And I think we lost a big piece, because all these practices, what we are realizing, could be simple mindfulness, meditation, yoga, which had actually, yoga was part of a religious practice, right? It now became everyday. So was mindfulness, so was meditation. So we can call it religion, we can call it spirituality, or any faith-based practices. I think it is such an important piece, or it can be such an important piece of your resilience and wellness, that but we are so apprehensive calling it religion because of this dichotomy that we have created between religion and science. But what is happening right now in the country, and especially American Psychiatric Association, has become big on faith-based mental health. They are realizing the importance. That said and done, it's interesting. Faith could be source of your resilience, but it can be seat of your trauma. It can be a source of your distress. But until unless we talk about it, I think it is, as a society, what I am right now when I work against stigma, um, be it with mental illness, culture, xenophobia, Islamophobia, whatever way stigma comes in our life. I think important piece that I'm learning is when we hide things, that's where we breed stigma. Visibility is viability. And I think overall, that's the thing I'm seeing in this generation, that the need to be open, right? Why are we seeing this increase in social media, these Instagrams and all this? Why? Because this generation doesn't want to hide and suffer. They want to be open about their pain. They want to talk about it, express it. And I think visibility is viability. So that's the piece that I had to really work through with faith-based communities, and especially South Asian community, where we were brought up to on these notions, which now I can trace it back to colonialism, that don't wash your dirty laundry in public, right? That don't talk about your calamities, or don't. Another concept, of course, is if you show your happiness, you will get the evil eye. So everything went back to, I think it is humanistic that when we cannot explain anything, if we can't quantify anything, we kind of don't want to, somehow it either gets supernatural phenomena or evil eye. So that's where for the longest mental illnesses were either, like if you are having a crisis, either you are possessed by an devil possession or a jinn possession, or there's evil eye on you, or somebody is controlling you through evil magic. All this is so prevalent in so many cultures. But what shocks me and surprises me is, and which is kind of you would face if you do pursue psychiatry, is the stigma that we see in our colleagues. The stigma that we see even in this educated community. And how is it translating then? If you look at the research, physicians, the burnt out rate, compassion fatigue, suicide rate, substance abuse rate, it's very high. But when you see the excess of care, it's the lowest in the physicians. Do you know, almost like I was shocked to read that maybe one physician die every day, something like that in the country, complete suicide. Maybe higher or maybe less, but just the thought that who we think we know how the body works, we don't want to know how the mind works, or how it's impacting our body, or how this compassionate fatigue, this burnt out, this depression rates, how it's bringing our quality of life down. So that's the stigma that really hurts me, that even in our medical field, there is such a stigma around mental health.
Yeah, I couldn't agree more. Thank you for answering my question.
I hope it answers it. It's a
Certainly did. Thank you.
I have a question kind of going off of that, Dr. Abbasi. I just finished my inpatient psych rotation, and it was pretty emotional. Like, I was in an inpatient psych unit. It was pretty emotionally exhausting. I was wondering how you take care of your mental health when you're dealing with some of these really tragic situations, or losing a patient, and things like that, and how you kind of, I don't know, separate it without being jaded
Right,
we found
right.
that.
I think overall, as being in, I think even if we just look around right now, uh, we are at the tipping point when it comes to stress and anxiety in the world, right? If you can look at any profession, any setting, housewife, working, um, um, father, I mean, everybody is feeling overwhelmed. Everything is right now, we are at a point. I think what you learn early on being a psychiatrist is you become very intentional with your mental health. You become very protective, cognizant, first of all, of your vulnerabilities, and then you become very protective of how to, as you are teaching others to take care of themselves, you become very aware of how I need to take care of myself. So that's where I talk about, you know, the cliche thing you hear all the time, that when the plane is going down and those oxygen masks drop, first put it on your face, even if you're sitting next to a child. I think that's such so literal for your mental health, that until unless you are doing well, there is no way you can provide care to the others. It's the same thing. If you remember, there was a time period in medicine where they were promoting physicians with cigarettes in hands, right? The smoking doctor was the image you had. Now we realize, the doctors realize that until unless we don't practice it, we can't preach. You remember there was a time that cardiologists, still you would see in some cultures, cardiologists are the ones having big quadruple bypass surgery, because we get into teaching to the others what we are not internalizing. I think with psychiatry, it's such a natural evolving process that you start to, so whenever I love this quotation that it's so easy to fight your weaknesses in others, right? When we see other people struggling, it's very easy for me to say, why don't you do this? Why don't you get up and go for 15 minutes exercise? But then when you are saying those words sound hollow, if you are not taking that time, you will not be able to convince your patient if you are not doing it, right? So it's in psychiatry that I think every physician should be doing that. Self-checking, self-loving, self-preserving is very important. Not to disclose for HIPAA, but just now I saw, I'm on call today, actually. I didn't realize I double booked myself today. Um, and I just saw a provider ending up with compassionate fatigue and trying to hurt herself. I'm not going to identify which field or what level, but the point is that is what happens. We get into the rut of like this paternalistic mind that I'm fixing others, I'm fixing others. And that's what really mental wellness, be anywhere you are in life, mental wellness is taking time to kind of have your own checkup in your mind, like, where am I? Mentally, physically, emotionally, where am I? That's where, mental health breaks concept have come in, mental health days have come in, that it is important to know your limits. And again, like I said in the beginning, continuing to remind yourself that you might be playing God, but you are not God. There is no way you can save everyone. That wasn't even our role. As a physician, I think it is important to know that we can only try our best, give our best, but in the end, we all have to be ready for the results. And I think right now, that's what's taking a toll with COVID-19. that helplessness, I think we get, this is a privilege being a physician in the country right now, right? Over in the world, actually, you become in that exclusive 10% club. So you constantly are thinking of the privilege, but you're not thinking of the sacrifices or the pain of getting to that point. It's a journey, right? And we have to continue to remind ourselves that neither are we invincible, or we are not, like, we will make mistakes, we will fall, we will make mistakes, we will lose people. But we forget that feeling of helplessness because we feel we have reached a point that we can overcome that helplessness, but that helplessness makes you human. That vulnerability makes you human. So knowing when you have given your best and knowing when to take that moment to acknowledge your limitations, that, yes, I did the best I could. I think that is where, to me, being honest and sincere becomes so important. If you have done the best in your capabilities, compassion, limitations, then there's no way I can control the outcome. So I think that's where I kind of navigated, how I navigated.
Thank you. It was really well said.
Any other questions? Like, just again, let me reiterate that we definitely are at a point that we are getting the best of the best students to come to psychiatry. That definitely, if you want to be a psychiatrist, or if that's the career you want to choose, I think it's good to start exploring it at least. If you can't get rotations, at least connect to people, find those mentors, talk to the residents. I tell you, MSU residents, they are the most giving people I know of. Really, really good residents that we have. And they are very willing to help, to mentor, to guide you through this process. And so that would be my recommendation, that it's interesting. Somebody said, right, that you will change your mind. Every rotation can make or break this decision, right? Some rotations you enjoy, some you hate. Sometimes it's the attending you don't like. Sometimes it's your mindset that you are in that kind of define the rotations for you right now. I remember when I was growing up, I would be so impacted by TV series, right? So if a TV series was on Law and Order, I want to be a CSI. If it's about a lawyer, I wanted to be a lawyer. So, it's like right now, but I say, keep yourself open. But if you are interested, then please take time to take these rotations, get the exposure. And I think the compassionate fatigue is a truth. It's very important to be cognizant of that. But I think right now, be it any field of medicine, that I think we all have to be intentional and take care of ourselves, whatever field you go into. But definitely, I think psychiatry is not only knowing the science, but unless you know your science really well, you can't practice the art of being a psychiatrist. So you know the science, and then you build on top of that the art of interacting with other human beings, art of holding someone's hand, being there, carrying their pain. That doesn't come unless you know the science under it. And it's interesting that we underestimated, like, when we talk about gratitude and kindness and act of kindness, why it's important, what is happening? So it's interesting, if you are volunteering or doing something kind for someone, what happens? Oxytocin get released in your body, right? But what we now know is, even if you read about an act of kindness, this same oxytocin releases in your body. But even if you see someone doing it, same oxytocin releases. So nothing is happening in vacuum, and that's what this ikigai is about. Ikigai, sorry. I'm sorry if there's someone Japanese, please do correct me. The ikigai, I think that's where I love this concept, is that it kind of shows you that balance, that things are not happening in a vacuum, that everything, every decisions flows in, one flows into the other. And in the end, it's about finding that balance between purpose and passion. So I think that would be my last thing to you all. May you find your passion in your purpose, and your purpose in your passion.
Thank you so much, Dr. Abbasi.
Thank you for including me.
Of course.
And I now have some medical students who are going to come back with me on my call. So see you guys there. Take care, guys.
Great. Thank you, Dr. Abbasi.
Please, in any way I can be of support and help, don't hesitate to reach out.
Thank you. Dr. Abbasi's email is in the conference program that I sent everyone, but if you need it again, just shoot me an email and I'll give you her contact info.
Take care, guys.
Thanks, Dr. Abbasi.